All right, guys, Dr. Jesse here at Health Fit Chiropractic and Sports Recovery in Boca Raton. Today we're going to continue our conversation from last week, and we're going to give you some at-home or in-office mobility work you can do with the hips to kind of make sure that your sedentary job isn't affecting your triathlete performance. So we're going to jump right into hip CARs. So hip CARs, CAR is an acronym used in the physical therapy world very frequently. It stands for Controlled Articular Rotations. So we're going to jump into that for the hip. Again, we're dealing with hip injuries in the triathlete. This is a very common at-home prescription that we give to our patients. So go ahead and let's run us through a hip CAR of the right hip here, so this way they can see. So you can see we're just going to bring it to the end range of each motion, starting with flexion of the hip. We'll bring it out into external rotation, back into extension, adduction, and then back into neutral. So let's run through that one more time. So, yep, flexion, we have external rotation and abduction here, back into extension, and this is at the end range of each range of motion. So we want to make sure we're kind of flirting with the edge of our comfort zone all the way through. That's a great exercise to do for overall hip mobility. You could just do this right on your desk. Find a wall in your office, right? This is super easy, no equipment required. Another one, no equipment, is hip airplanes, which you've seen us do a million times in our channel. So the patient's going to lean forward onto a desk or a wall. They're going to get back into their hips. So go ahead and hinge back into your hips there. Good. Really get into that. Good. Great. And then bring this leg up, and we're going to come up into an airplane position. So you can see what that looks like from this side. So she's working this left hip in external rotation here, and she's going to bring it back into internal rotation. Good. So I want you to see what that looks like on the other side. So let's do that on that right foot there. So I want you to see that she's not doing all this crazy motion with her spine. Her spine is staying nice straight up and down, and all the motion is coming here, right, between these back pockets and the seam of the pants here. Is doing all the work. So go ahead. Out into external rotation, nice neutral spine, and then she's going to come into internal rotation here, okay? So this is another great one to do. All right, our last stretch, in-office stretch for hip mobility, is the standard hip flexor stretch you've seen done wrong in the gym a million times. We're going to show you the correct way to do it here, okay? So remember, the hip flexor originates from the front of the lumbar spine, okay? I want you to remember that. That's crucial here. So if you just lean forward as far as you can, how far? She's going to have to get pretty far in order to feel a stretch in that hip flexor. That's because her spine is extending as we tug on that hip flexor. So come on up for me. So in order to get a good, adequate stretch in that hip flexor, we're going to make sure we stabilize the spine, okay? The analogy I use all the time is we're going to turn that slinky into a tree trunk, okay? So we want to make sure that that spine is not moving. So in this case, I'm going to use a brace. So I'm going to have her brace her core. And I always say, pretend I'm going to punch you in the stomach, right? So you want to feel that brace happen, and you just want to translate the hip forward, okay? So I say it's like if I'm pulling a rope on your belt buckle, okay? You're not sinking down into it, you're translating forward, and she only needs to get to there to feel that stretch in the hip flexor, okay? You can add to that here. You can come up and over, and you can reach up and over in order to get a little bit of an oblique stretch here. This is great. You hold 30 to 45 seconds. Again, minimal equipment. All I would recommend is throwing something underneath your knee so you don't bang your knee up on the hardwood floor. You could relax for me. But yeah, again, minimal equipment.